And hi, everyone. We're just going to wait a few minutes and let some additional people join, and then we'll get started with our webinar. Okay, I think we will get started. We'll be recording this, and so if anyone would like to see the recording later, please let us know. My name is Michael Gusmano. I'm the Associate Dean for Academic Programs and a professor in the College of Health at Lehigh, and I'm joined by my colleagues Morgan Volkart and Jen Top, who will be monitoring the chat and helping me to answer any questions you may have along the way. What I'm going to do is begin with a quick overview of the College of Health, and then we'll stop and with the remaining time answer any questions that you may have. You'll see that the Q&A feature is enabled, so if you do have any questions along the way, please use the Q&A and we'll make sure to address your questions as best we can. So, good afternoon, good evening, or good morning, depending on where you are in the world. I'm so happy that you've decided to join us. I have just joined the College of Health this year. It's an exciting new college at Lehigh University, and I want to tell you why I'm hoping that you will apply and join us. So why would you want to join the College of Health at Lehigh? And part of it is we talk about this as an opportunity to turn your passion into purpose. Many of you, if you're considering the College of Health, care about public health issues, you're worried about health equity perhaps, and what we can do for you is provide you with the knowledge and the skills to turn that passion about health equity into action, into interventions that can actually make a difference in the world. As we know, the stakes have never been higher globally. We've all been living through a pandemic for nearly 2 years, and we see the implications of an infectious disease breakout like this. And not only is the pandemic highlighted the importance of infectious disease, but it's also told us about the importance of non-communicable diseases. If you look at who's at greatest risk when they contract the virus, it's people who have underlying chronic health conditions, people with diabetes, high blood pressure. And so all of the things that we study in population health have really been highlighted by this global pandemic. And of course, from a narrower point of view, thinking about why would you study health from your own individual perspective, although we think about population health, the US healthcare sector is booming, and it's not just the US. In fact, the healthcare sector throughout the world is one of the fastest growing segments of the economy. There are nearly sort of 800,000 companies and not-for-profit organizations focused on health. Employment in this area is predicted to grow by 15% over the next decade, with over 2.4 million jobs in the US alone. So this is a great area to study if you're interested in future employment. I presume most of you are. If not, I assume some of the parents who are on the line certainly are wondering about future employment. So in addition to the fact that we have this wonderful kind of core liberal arts education at Lehigh, studying population health, community, and global health will set you up really well, whether you're interested in going right into work or going to graduate school next. Why Lehigh and why the College of Health at Lehigh? We've been set up to help people solve critical issues in population health using data science and with a focus on health equity. And so whether you're interested in going to medical school or dental school, studying health science, getting involved in entrepreneurship and working in the private sector, or engaging in community health interventions, we may be the right place for you. So let me start with data science, because that's really been a focus since the beginning of the College of Health. One of the things that you will find with, particularly with our Bachelor of Science curriculum that I'll talk to you about, but all of our programs and with a lot of our faculty, is we try to use data, the power of big data, to really answer a lot of questions about why public health may be deteriorating, opportunities to improve public health, and why some interventions are working rather than others. I mean, this is a remarkable time to be alive when you think about the capacity of taking big data and computer science and applying it to population health. I myself use large data sets looking at hospitalizations and death. Some of our other faculty look at hospital surveys, and some of them collect original data. Many of our biostatisticians and epidemiologists are involved in advanced programming, looking at machine learning and artificial intelligence. And as a student in the College of Health, you will actually learn some of these skills and very early on be given an opportunity to do some programming yourself. We have a lot of students who are freshmen and sophomores who are actually pretty sort of amazed at themselves, because by the time they get to that stage in their education, they're already using big software packages like R and Python to engage in predictive modeling, working directly with our faculty. All of our degree programs at the College of Health are focused on understanding the determinants of health, these sort of broad factors that shape your health. And we care a lot about health equity. It's almost a cliche, but in public health, we often tell people that your zip codes matter more than your genetic codes. And certainly, even though genes matter and genomics matters, it's that interaction between genes and the environment that really helps us to better understand why some people are healthy and others are not. We have experts in environmental pollution within the College of Health that are looking at the quality of air and water. A lot of us pay a lot of attention to income and poverty. We look at the effects of structural racism on health and what we can do about that. We pay attention to your social networks. And I'm a political scientist by training, as is my colleague Edward Gomez. And Eduardo and I look at government at all levels. And of course, we pay attention to culture. So if you're looking, for example, at the map in the lower right corner, you can look at the zip codes in New York City and look at COVID deaths per 100,000. You see massive differences within the city that actually correspond to many of the well-known determinants of health that influenced health equity before the pandemic. So the pandemic highlighted problems that have always been there. So where can you work? What can you do with a degree from the College of Health? Well, actually, the possibilities are quite broad. Certainly, a lot of our students will be prepared to work in the for-profit sector, working for insurance companies, pharmaceutical companies, consulting companies, lobbying firms. But others may choose to look at the not-for-profit area, looking at NGOs, looking at various government and quasi-governmental organizations. Some of you may even consider working for philanthropies. One of the things that I like to tell students is most of us growing up don't think about the fact that maybe one day we could be program officers for the Gates Foundation or the Robert Wood Johnson Foundation. That's an actual career. So you can do that job with expertise that you would get from the College of Health. And of course, you can do more sort of traditional jobs that you might associate with public health, working for the Centers for Disease Control if you develop expertise in epidemiology, looking at state and local governments, even international organizations. And those salary ranges are just from a quick search that we did from looking at LinkedIn to show the kinds of ranges of starting salaries for jobs in these various sectors. So how do we prepare students at the College of Health? Well, we have sort of three distinct things that make up your education, sort of three promises that we like to make to our students. The first is that we have an innovative curriculum, and I'll talk about this. We have a lot of opportunities for experiential learning. In many colleges and universities, they will make room for internships and other fieldwork experience, we actively encourage it. In fact, for our BA students, we require a field work placement. And then, of course, we also pay attention to your career and try to integrate your professional development into our educational program. So let me start with the first and talk about our innovative curriculum. We have 2 undergraduate majors in the College of Health, a BS in Population Health, and a BA in Community and Global Health. We also have 5 recommended minors, although we're fairly creative and allow our students to develop their own minors. And then we actually have an accelerated program that will allow you to combine an undergraduate degree with a master's level degree. But let me start with our 2 academic majors. The BS in Population Health is really more focused on people who are interested in health data science, who are interested in learning how to use some of those software packages and skills I talked about earlier to mine big data, to explore public health questions. The BA in Community and Global Health is for students who are interested in doing a deeper dive into the social determinants of health. Some of them use quantitative analysis, and some of them really get a lot of training in how to do qualitative analysis, including community-based participatory research. The 4+1 accelerated programs, I'll just mention here quickly, and I'm happy to take questions about this. We are launching next fall a master's degree in population health, an MS in population health, and a more traditional master's in public health. And it is possible to do either one of these degrees and get started on them when you were an undergraduate here at Lehigh. So if after your sophomore year, you have a GPA of 3.5 or higher, and you decide, you know what, I really want to continue this beyond my bachelor's degree, all you have to do is tell us that you're interested in joining the 4+1 accelerated program. If your GPA is 3.5 or higher, you will be automatically accepted, and you will actually get a 20% discount on the 1 year of graduate work that you do with us beyond the undergraduate year. So you'll complete a master's in 5 years rather than the usual 6, and it will help not only save you some time, but a little bit of money. So just something to consider if you decide to join us. One of the things that some of you may be wondering about is, well, you know, I really want to go to medical school, and shouldn't I just get a traditional, BS in biology, for example? Isn't that the usual path to get into medical school? And that's certainly fine, but the College of Health may be able to help you. Lehigh overall, whether you join the College of Health or actually join one of our other colleges in arts and sciences and do pursue biology, has done a great job historically at getting people into medical school. The rate of acceptance into medical school for Lehigh students is well above the national average. And in the College of Health, we think we can help you stand out if you're interested in this path. So you see here, 58% of the people who apply to medical school are biology majors, which is what you would expect. And we would fall more into, I guess, the specialized health sciences. The reason this might actually be helpful to you is, as my department chair, Chris Daly, likes to point out, she was on the admissions committee for the Kansas University Medical School for many years. Everybody's a biology major. They get really excited when they see somebody who's a little bit different. Now, of course, you have to do your pre-med or pre-health courses, and we've actually mapped out. So if you go onto our website, you can see how you can do our curricula, either the BA or the BS, and still complete all of your pre-health courses. So we would not only encourage you to consider this, we will help you along the way and make sure that you're well prepared if that's your passion and what you'd like to do with your degree. All right. So let me just give a little bit of detail about the BS in population health. You'll see that we have some core requirements, an intro that gives you a sort of a basic understanding of the field, a research methods class, some methods in epidemiology, and then we have you do a deeper dive into data science, really looking at how to construct some algorithms. And you have an opportunity to take electives, All of our students have a core college requirement, a distribution requirement to better understand the determinants of health. And then our BS students also do a capstone project. And I should mention that one of the things that really makes Lehigh distinct is the degree to which undergraduates get involved in research. So we are a research university, but with an undergraduate focus. I already have, in my first full semester as a faculty member here, 3 undergraduates who are working with me on projects. And as I'll talk about later, we've had lots of examples within the College of Health of students getting involved in research early on. And then we have electives. Now, the BA in Community and Global Health is a little bit different. You will see here under the core requirements, we have you do an even deeper dive into the social determinants of health. And there's also a requirement of a field experience or a practicum. So we want actually people within this degree program to go out and work with organizations within the community, and we train you in how to do community level research and work. In addition to the quantitative courses, we also require students in the BA to take at least one qualitative methods course. So you can learn about interviewing or community-based participatory research. There's a cultural diversity requirement and a collateral requirement in a modern language. And again, of course, course electives. We have, in addition to our 2 undergraduate degrees, we are launching, as I mentioned earlier, an MS in Population Health and a Master in Public Health. And we plan on launching in 2023 2 new master's programs in collaboration with our business school. And we're launching this fall a doctoral program in population health. So something for all of you to consider for down the line. All right, let's talk a little bit about experiential learning. As I mentioned, this is a key part of what we do. Oh, I've skipped through there. It's another terrible photo of me, so you have to look at me twice. So these are just some examples of field work that our students have done and research that they have done in the field with our faculty. We have students who have looked at cancer projects, have done mathematical modeling to predict COVID-19 breakouts. People who have worked very closely with my colleague, Professor Choi, looking at environmental pollution and asthma in Pennsylvania. The students who are at the top there were giving a presentation in which they were actually putting together data that's now being used by the state of Pennsylvania. So this has led to real world impact. We have people studying environmental journalism. And because, as I'll mention in a moment, we have an Institute for Indigenous Studies, we have a lot of students who have been working with Professor Sean and Professor Chris Daly looking at Native American health. So we have students working all over the country and all over the world. Obviously, some of this has been virtual during the pandemic, but we hope that some of it will be in person moving forward. And speaking of our faculty, I have a lot of really extraordinary colleagues here. They have a diverse set of backgrounds in anthropology, in epidemiology, public health, political science, sociology, math, statistics. And the really exciting thing is that we are growing our faculty. So by the time you would start with us in the fall, in addition to all the people you see on the screen now, we'll have 8 additional faculty. So this represents a real investment by the university in the College of Health. Beyond that, this is a very old university. It didn't just start with the College of Health. And there are other programs here where their faculty have a health focus. And we collaborate all the time with those other faculty. In fact, 50 faculty from engineering, business, arts and science, education are now affiliated with the College of Health. And so you may take their courses and work with them on research. Now, some of you who are students may not know who this is, but if there are any parents listening in, or if you ask your parents, you may recognize Joan London. Joan London is a pioneer in American media. She was one of the co-hosts of Good Morning America, and really one of the leading women in journalism in the United States. And we are extraordinarily fortunate because she is our distinguished scholar in residence. So she is teaching a course for us in the fall, and she'll be teaching another in the spring, population health and media. And she brings in leaders because her connections are remarkable in government, in the private sector, in the media, and she interviews them in front of and with her class. And her students get to ask questions of all of these leaders, and they get up to write their reflections on what they have learned from these interviews. So we're really excited to have Joan London as a member of our faculty. Another really unique thing about Lehigh University as a whole, and where the College of Health really can take advantage of this, is our partnership with the United Nations. Lehigh, I believe, is only the 4th university in the United States to have NGO status, non-governmental organization status with the UN. What does that mean? Well, among other things, we have special access to the UN. Our students, every Friday, there is a bus that goes to Lehigh, to New York, to the UN headquarters, and our students are able to actually get to the floor of the UN during speeches and other events. They've been able to meet with people who have been on the ground for the World Health Organization, dealing with various infectious disease breakouts. And of course, now that the College of Health exists, we're planning to extend some of our relationships with the World Health Organization. So for those of you interested in global health, this is really a remarkable opportunity to have access to, the leading multinational organization. And I see Jen Top, my colleague, has put in some interesting links for you, including a link to Joan London's biography. So for those of you who want to learn a little bit more, that will be terrific. Let me see if I can get this to advance. There we go. So let me just talk about, I've mentioned them before, but we actually now have 3 institutes. Institutes at Lehigh are really interesting. They promote research, but they also promote cross-university collaboration. So they give faculty and students from different parts of the campus an opportunity to work with each other and to partner with people outside the university. Our first institute is the Institute for Indigenous Studies, directed by Sean Daly, who is an anthropologist. And together with Chris Daly, our department chair, they have been working with American Indian and other indigenous populations from around the world for decades. They are a very well-funded institute with grants from the National Science Foundation, from the National Institutes of Health, and they have been working with American Indian tribes on everything from tobacco control to weight loss, and as you would expect during the past couple of years, on the responses of these tribes to the COVID-19 outbreak. A number of our students are actually working with the Institute on various projects, and if you're interested in this, you can get involved as well. I actually think this is one of the things that really makes us stand out, because there aren't that many schools of public health or programs in population health that are actually going to have this kind of focus and expertise. I mentioned earlier, I'm a political scientist. So not surprisingly, I am very excited about this new institute that was just started and approved by my colleague, Eduardo Gomez. Eduardo is a fellow political scientist who does brilliant work in global health, and he has kicked off the Institute for Health Policy and Politics, again, bringing people together throughout the campus to do research projects. We're going to start a white paper series, a lecture series, and we may kick off a journal in the near future. And so if you're interested in understanding the politics of health reform in the US or the politics of public health globally, this would be a great place for you to get to know if you join us here, and there will be lots of opportunities for students. And then finally, this is our most recent institute. I mentioned Dr. Choi earlier. This is the Children's Environmental Precision Health Institute, and she is going to be using big data and epidemiological studies to better understand the impact of the environment and environmental pollution on children's health. As I mentioned earlier, she's already started working with a number of our undergraduate students on projects with real-world applicability in the state of Pennsylvania. So we're quite excited about this new institute. The other thing we're excited about, and I'm actually really excited because I just got my packing materials. So we are going to be moving in January into our brand new building. So we have the Health Science and Technology building. It will house a number of faculty and research labs throughout Lehigh University that are focused on issues around health, but it will definitely be the home for the College of Health. It's this gorgeous kind of public-facing building, lots of glass. It actually has a community room where we're going to invite groups from the community to come in and interact with the College of Health and other faculty at the university. It has a cafe. Our students are actually running a contest to name the cafe, and incredible sort of conference space and labs and room for those of you who end up becoming research assistants or teaching assistants. And so this will be our home starting, I believe, January 15th is when we'll be moving in right before the new semester. So let me talk about integrated career and professional development, because we start early on in your undergraduate career, helping you think about what you're going to do with the rest of your life, what you're going to do with this degree. We've had lots of student internships in exciting places, people working for the Pennsylvania Department of Health, working with the city of Bethlehem, working with a number of healthcare companies that are in the area and beyond. And so we are in conversations with most of the major hospitals in the Pennsylvania area and in the New York, New Jersey area. And so if you are interested in working for an insurance company, working for a biotech startup, working for a government agency, we can get an internship for you so that you can explore what it's like to work in those environments and apply some of what you're learning in the classroom. And we engage our students in other ways. In addition to involving them early on in research, we're actually, as a brand new startup, you can think of us as a little startup corporation. The brand new College of Health is involving our undergraduates in the creation. If you come here, you will have a very unique experience to actually co-create a brand new college at an old university. And so our dean started a student advisory council. Right now it has 19 College of Health students. It meets monthly with the dean to talk about student issues, undergraduate program development. They are going to be directly involved in the faculty searches that we're conducting. And so we have all of the prospective faculty meet with our students, teach them, be interviewed by them, because we want their input in shaping the college. We have 16 what are called student ambassadors that help with admissions and recruitment. And once a month, all the undergraduates are invited to meet with our interim dean, Beth Dolan, to talk about anything that's on their mind. So we take input from students very seriously, and we really enjoy working with them. And so just to end with a few quotes about what our students have been saying about the College of Health, if I may. We have one quote: all of our professors that have encountered have not only been very welcoming, but also very helpful. And I know they'll continue to be helpful and supportive throughout my college career. Another student who was talking about how excited she was to work with Professor Choi, and ended up sort of joining us too. And then this is a sort of a really beautiful quote. This is a student who actually joined us in his senior year. The College of Health didn't exist when he came to Lehigh. He was going on, he wanted to study dentistry, but he was so excited about the college, he actually completed a minor in 1 year, doing lots of coursework. And so you can see this quote, he's sort of looking into the medical field, and these courses have taught me the information necessary for dental school, but population classes have helped me better prepare me to work with patients and approach every individual situation empathetically. And so we are really deeply grateful for his enthusiasm for the College of Health. So I'm going to end there and stop sharing my screen. Thank you for indulging me for that long presentation, but now I really want to open it up. I see we have some things in the Q&A already.
Yes, Michael, I was answering a lot of questions as we went along.
Thank you.
But there are a couple that I really think that you and Morgan should address. one of which was, what do we look for in a good candidate for admission to the university? Whether grades, essays, characteristics, etc.
Well, it's a really good question. Obviously grades are important and we pay attention. We want students who are going to be prepared and who are going to succeed. But as I said, we're a college that focuses on turning passion into purpose, right? And so we're really interested in learning more about you as an individual. What makes you tick? Why do you find this whole field interesting? Why are you excited about public health? And what do you hope to do with this career? So yeah, we look at grades certainly, but I think the personal statement is really quite important, certainly to me when I'm reviewing these things, and I know it's important to my colleagues as well. Morgan, I don't know if you'd like to add anything to that.
Yeah, I think that was right on target. I mean, first and foremost, we want to make sure students are going to be academically successful in the rigor at Lehigh, which most applying to Lehigh, have those grades and have that rigor. So it really boils down to, who are you as a person? How do you see yourself contributing to Lehigh? What are those opportunities that you want to take advantage of? So attending sessions like this, spending time on the website, doing your research, and really trying to picture yourself within our programs and on our campus will be really helpful, because those supplemental questions that we ask within the application are really important. And one of them is, why did you select the college or the program that you're applying to? And so having that knowledge from this session and other things that you attend will be extremely beneficial in answering that question, and also helping us to get to know you better as a person and how you could potentially contribute and take advantage of what we have to offer at Lehigh.
Right. One of the things I like to tell students is you're always focused on how we're evaluating you and whether or not you're smart enough and have the grades. And yeah, of course we're doing that. But one of the other things that we're doing when we're looking at applications is we're trying to figure out, is this a person who would do really well here that we could support, right? Are we teaching the kinds of classes? Are we doing the kinds of research that this student is going to find exciting? And so the more you can tell us about you, the more we'll sort of figure out whether you're a really great fit here. I think the students we have so far have been terrific, in part because they have so much passion for the topic that they're pursuing. And I just wanted to mention, I also, and Jen helped me out as well. I did put down my email, and we've put down some ways in which you can chat with us after the session. And please feel free to reach out if you have any interest. And then I see we have one question, or you've already typed the answer to what health major.
I started, but I wasn't sure how to answer that, so I want to defer to you.
Yeah, I mean, it really depends. We certainly accept double majors from other parts of the university, and we have a lot of people from the business college, arts and sciences, even engineering, who minor in the College of Health. Part of it, I would say, the through line that connects all of our academic programs is a passion for understanding social determinants of health, right? What are those factors, the physical and the social environment, that shape health? And certainly almost all of us, I think, are focused on reducing inequalities in health. We do it in slightly different ways. So for the students in the BS program, they're a little bit more focused on doing quantitative analysis, right? So if you are uncomfortable with math and using large data, the BS probably isn't for you, but the BA may be, because we have a lot of faculty and a lot of courses that are really focused on understanding policy, understanding how to do and how to use qualitative analysis. We've had people who have an interest in, our interim dean, has a PhD in English, but she's interested in the medical humanities, and she's done remarkable work looking at the expression of suffering and understanding suffering as part of her research. And so we really have a broad view and understanding of what population and community health involve. So if you're a psychology major, Some psychologists really get into deep quantitative analysis. My former department chair at the former less good university where I was before, he did a lot of really big data set analysis. But I know other psychologists who are really interested primarily in theoretical questions. And so the BA or the BS could be an option for you. And you know, there's an opportunity, particularly if you're coming in majoring in psych, to take intro to population health and take intro to community and global health. Figure out which one excites you more. Feel free to type in any other questions.
And there were lots of questions about combining different degrees and combining different programs. And I kept emphasizing how interdisciplinary, multidisciplinary Lehigh is, and
Yes.
especially within the College of Health, how you can really customize your degree.
Well, and I will say that we're probably going to become even more so in the sense that our new president has placed an emphasis on the importance of interdisciplinary programs. I actually have a meeting scheduled next week with colleagues from the College of Education and the College of Arts and Science to talk about how we can further develop interdisciplinary programs with the College of Health. So we are inherently interdisciplinary as a college, which is what's so exciting about it to me. I work with anthropologists, economists, epidemiologists, sociologists, just within my own college. And then, of course, we branch out and we collaborate with other people across the university. And as students, you have an opportunity to do that as well. And certainly, regardless of where you are within Lehigh, there are university distribution requirements. So you're going to have to take classes from across the university, regardless, just to graduate and fulfill all of your credit requirements and graduation requirements. But within the College of Health, you'll have an opportunity to learn from faculty who have very different backgrounds, right? There are some of our faculty who were undergraduate math majors. I was a political science philosophy major. I was the farthest thing from a math major you can imagine, although I do a lot of big data set work these days.
There's another question, another open question. It's a twofold question. What is the average class size going to be like? And what are some good internship programs for students who want to go into pre-med? I can help you with that a little bit if you like, but.
Sure, jump in and I'll add too.
Okay, so the internship programs so we are developing a really robust internship program in general for the College of Health students, because it's part of the promise to all the students that you will get experiential learning opportunities, whether it's an internship, research with faculty member, or study abroad, and all those things can also be the other. So there's study abroad experiences that include internships and or research. We are developing for pre-med in particular. It depends on what you're interested in. We are going to be partnering with health systems, healthcare systems providers, community global health folks in the nonprofit sector. It really depends on what your interests are, and because we are building it as we speak, your input as a student will have so much weight. As Professor Guzmano said, you will have a real influence on what we develop based on what you're interested in.
Yeah, and I would say in the past, I've had pre-med students who have done internships in hospitals and clinics, in part because they really wanted to better understand what it was like to work in those environments and to figure out, hey, is this something I want to do with my life? But on the other hand, if you're interested in working with, a public health department or an NGO that is doing health promotion, either in the US or around the world, that can be one of those things that really makes you stand out. As I mentioned before, everybody's a biology major or a lot of people are a biology major when they apply to medical school. And if you're something a little different, that can make you stand out. Increasingly, if you speak to hospital executives or physicians, they are interested and aware of the broad social determinants of health. So if you understand, for example, how inadequate housing can actually make it difficult for someone to manage their diabetes, they're going to find that pretty exciting. So you might have an internship working for a housing authority that seems not connected to health, but actually is. In terms of class sizes, the other part of your question, the nice thing is they're really quite small. So I have an intro class that's required for all of the community health students. It had 39 students in it. That's one of the largest classes you will see. There are a couple that have been larger. Most of our classes are really 15 to 20 person seminars, and some of the upper level classes will be quite a bit smaller. So unlike some other large universities where I know my experience, I was in a lecture hall with 250 or 300 people, and the professor was a little dot walking around the stage. You really have an opportunity to sort of interact much more with our faculty because we keep our class sizes pretty reasonable.
Morgan, there's a question, what is the acceptance rate to the College of Health? I think that's like a you question.
Yeah, so I don't know that answer off the top of my head. I know that it does vary slightly between all of our colleges, but we don't always have that information readily available because, ultimately students, when they're applying to Lehigh, although you do pick one of our colleges, you are applying to the university as a whole. And sometimes students move around, as I'm sure some students from maybe other colleges have moved into the College of Health over the past couple years. And so I think that's important to know as well. But you can certainly email the admissions account or your admissions counselor, and then we can look into what that is if you're really interested.
Right. I think the overall admission rate for Lehigh is not going to be radically different for us. And so if you get the sort of general information, that's enough. And yes, we've some students come in undeclared, some students come in with a particular major. I think for our engineering students, that tends to be that much more important because it's a very structured and detailed program. So it's very difficult if you don't start out in engineering, it's very hard to finish in 4 years and catch up. That's really not the case for the College of Health, whether you're in the BS or the BA. In fact, one of the reasons we're able to tell students that they can do all of their pre-health courses and still fulfill our requirements is it's possible to do a lot of your pre-health requirements in the first year and not really begin with your College of Health courses until sophomore year and still catch up. So we have rigorous requirements and quite a bit of them, but actually, you have the opportunity to switch around and make sure it's right for you. Although we'll be delighted if you join us from the beginning. So we have some more time if you would like. Don't be shy if you have any questions about courses, questions about the research that's being done by faculty. I don't know about questions about the building. I have only been in it once in a tour, but I could try to answer some of those. Or questions about Bethlehem. I'm actually new to Bethlehem, but Jen is not. And if you're interested in Bethlehem, Pennsylvania, the Lehigh Valley, just kind of what it's like to live around here, we'd be happy to answer those too. I can say I find it to be an absolutely delightful town. There's always stuff going on. There are festivals, concerts. It's really one of these fascinating northeastern towns that has reinvented itself in interesting ways. You can go to a place called Steel Stacks, where you get the burners from Bethlehem Steel in the background and watch concerts outside. So it's a really fascinating place to spend time. Is wet lab research planned or being formed in the HST building? Oh, absolutely, yes. There are huge wet labs in the building, and so it's really going to draw on people from biology, people from the engineering college who are doing work in wet lab spaces. So we'll have a combination of, data science labs for doing the kind of work I do, where we will store kind of large data sets on hospitalization and health survey, but it will also have people doing bench science within it. It's a pretty remarkable building. They have, I'm not entirely sure what it's for, but in the basement level, they actually have a whole wall made out of glass that changes colors. It's beyond me what it's for, but it was shipped in from Ireland and it looks really cool. So I'm pretty excited about that.
Morgan, there's a question about interviews and I was about to type it, then I thought maybe it's changed. Are interviews required or they're optional?
Yeah, so interviews are completely optional in the process, and students can do them both in person when they're visiting campus or virtually. At this point, if you are a senior currently applying to Lehigh and you're just finding out that we do interviews and you'd like to do one, once you submit your application to Lehigh, you'll have an applicant portal where you can actually request a virtual alumni interview. And so once you submit that application, if you're not seeing it in your portal, let us know, but you should see that and you should be able to go ahead and request an interview that way. But remember, you first have to submit your application to Lehigh in order to have access to that, unless you're visiting campus and we're offering interviews at that time. And while I said they're optional, they are both informative and evaluative. So we'll be asking some questions of you that will help us get to know you outside of your application a little bit better. And then there will be plenty of time for you to also ask questions about anything Lehigh at all. And so it's really just a great way to learn more, have that one-on-one time with either an admissions counselor or one of our senior students who's been trained to do interviews in our office.
Yeah, and I will just add to that, that even though the college is new and therefore we don't have many alumni, we actually have a fairly broad network of people who graduated from Lehigh who either studied health-related topics or who are working in the broader population health and community health field. And they have agreed to interview students for us and serve as ambassadors for the college. So the dean and I have met with them. They're fantastic. And so it is a terrific opportunity if you want to take advantage of it for learning more about Lehigh and for us to sort of learn more about you.
I can definitely answer the question about sports, and I think Morgan could, from personal experience here at Lehigh too. We've got a very vibrant sports program here, and very, very, very into it. We have the longest continuously running rivalry. Am I saying that right, Morgan? With football with Lafayette College, and we just had our game 153rd, something like that, a couple weeks ago. And school spirit is massive. We have all kinds of really amazing traditions attached to school spirit. Yeah, we're good in wrestling. We used to be good in basketball. I don't know if we still are. I don't know. But
I know we have lacrosse fields. So.
We have lacrosse. We have all kinds of really great sports. And school spirit is crazy around sports and other things. And then there was a question
about internships in Latin America.
Yeah.
Yes, absolutely, we do. One thing I'll sort of note is the Study Abroad has a fantastic program in the Dominican Republic, and we encourage our students to do that. Also, I mentioned Eduardo Gomez, my colleague who started the Institute for Health Policy and Politics. He has actually done a fairly extensive amount of work in Latin America and in Central and South America. I've done a bit, not quite as much as Ed, but I've done a bit as well. And so in addition to the formal study abroad programs, a number of the faculty have contacts in Latin America. And so we'd be very happy to help you explore that if you came here.
We even have a program called Lehigh Launch where you can go to, is it Peru or Ecuador, Morgan?
Ecuador.
Ecuador. Okay, thank you. And that's where you'd start out your time at Lehigh, your first semester in Ecuador. And the school that hosts that has amazing opportunities for research experiences, and just learning about it, because they have a Galapagos Island Research Center and all kinds of amazing opportunities. There's almost too many choices for study abroad.
Yeah, I learned about that program when I first came to Lehigh, and I was told that I was too old because I actually wanted to do it myself.
Yeah, same. These are such great questions. Thank you
Yes.
so much for all this range of questions. We're coming up to the end. Any other questions that anybody can think about, please put them there. But again, if you have any questions about the program specific, College of Health specific, Michael, Professor Guzmano, and I are happy to answer those questions, and then certainly questions about financial aid and anything admissions related, strictly admissions related. Morgan also put the link in there for you to get in touch with your personal regional admissions counselor. And we love to talk to students. That's why we do what we do.
And I will say we weren't able to have any students join us for this webinar, which we often do, in part because our students take their responsibilities very seriously, and we're in the middle of finals week, so they're studying hard and taking exams. But if you'd be interested in speaking to one of our students, I'm sure we could arrange that as well. All right, well, if there aren't any more questions, we can end, but we'll wait just another minute to see if anyone else has a question they'd like to ask. But let me just close by thanking you for taking time and joining us here tonight. I hope you are as excited about the College of Health at Lehigh as I am. It's really a vibrant place. I came here from Rutgers University, which is a terrific place, because I saw an opportunity to do something innovative and interesting at a really terrific university, and I have not been disappointed. My colleagues are wonderful. The students here are terrific, and I hope you'll join us. Nope, I think we have. Oh, you're very welcome. So thanks so much. All right, so if there are no other questions, we will let you go a couple of minutes early and then enjoy your dinner or your breakfast or wherever you are in the world. Thank you to Jen and to Morgan for joining me tonight. And thanks to all of you. Please let us know if you have any additional questions.
Thanks, everyone.
Bye-bye.